I walked out without having to pay a single thing in Australia.
My dad got a stent in Toronto. He paid more than you did because he had to pay for the parking.
I lived in London. Ali Velsh's Canadian. Places where there is a national health care system. You get checkups in London, you walk in, you walk out. I was in Australia. I really messed up my shoulder in a fall, and I had to go get x-rays in the ER. I walked there bloody and messed up. They gave me x-rays. They gave me pain medication. I was in the ER for, I don't know, 6-7 hours, and I walked out without a bill. Without a bill. I was a tourist. I walked out without having to pay a single thing in Australia. And if I had done that here, I would be paying thousands upon thousands of dollars. If I had, quote unquote, good health insurance, I would still be paying hundreds of dollars. This idea that people love their health insurance is just crazy. They tolerate their health insurance. Nobody loves their health insurance in this country. They exist to find a way not to pay for your health services.
Look at your paycheck. Anybody who gets their employer-sponsored health care, some of it's subsidized by your employer, but it's generally one of the biggest nuts on your paycheck. Two, my dad got a stent in Toronto. He paid more than you did because he had to pay for the parking. That's the one thing he learned is don't drive to the hospital because the one thing health care doesn't cover is the cost of parking. It covers everything else. Canada and the United Kingdom both have single-payer health care systems. Guess what? Life expectancy is longer. Outcomes on most things except cancer treatment is better in all developed countries than in the United States. And here's the rub. In many of these countries, the system was either established by or continued by conservative governments because the return on investment is greater. In America, we spend almost 3 times as much as what they do in developed countries for health care. So the idea that this is socialist and radical, which, by the way, I encountered when I was out there on my tour across America, the idea that you're paying collectively for insurance is not socialist. Socialism is government-controlled production. In Canada, the government doesn't control health care. It just pays for your health care coverage. It's something we should be coming around to, and exit polling indicated that a lot of Americans actually still believe that.
In the UK and Canada, they have the National Health Service, so they have a ready-made way of tracking and bringing people together and distributing something like this in a very orderly fashion.